Which of the following is an organizational factor that affects workplace violence directed at nurses? A. Clients who have short hospital stays. B. The presence of security guards. C. Restricted client areas. D. Understaffing of nursing personnel. The answer is D. Understaffing of nursing personnel. Understaffing of nursing personnel may be an organizational risk associated with workplace violence for nurses. Understaffing involves too few nurses on duty, which may not be enough to meet client needs at the time or may result in longer delays for provision of care. Greater amounts of activity and diminished numbers of nurses to provide care may result in aggression, violence, or anger from clients or families directed toward staff. A client has been diagnosed with a form of terminal cancer and has started receiving hospice care. The nurse notes that both the client and his family avoid talking about the diagnosis. All attempts at discussion result in changing the subject. The nurse recognizes that this family is exhibiting A. Closed awareness. B. Mutual pretense. C. Open awareness. D. Powerless assessment. The answer is B. Mutual pretense. Mutual pretense is a form of awareness as a response to death or dying in which those involved avoid discussing the situation. In a case of terminal illness, a client and his family are aware of the diagnosis, but the client may not want to talk about the situation for various reasons, such as saving his family from feelings of grief, fear of the future, or discomfort with talking about feelings. A nurse is preparing to talk about body changes with a client who just had a bilateral mastectomy. Which of the following actions of the nurse is most appropriate during this discussion? A. Provide a room that offers minimal distractions. B. Ask closed-ended questions to allow the client to think about her situation. C. Write detailed notes during the conversation to track important information. D. Ask personal questions about the client's background to determine how the procedure has affected her. The answer is A. Provide a room that offers minimal distractions. When preparing to talk with a client about a difficult subject, the nurse can provide an environment that is private and that offers minimal distractions. This gives the client an opportunity to open up about personal feelings without being interrupted, and may provide more open communication between the nurse and client. A nurse is attempting to speak with a client about his personal feelings of self-esteem and self-concept. Which of the following questions is most appropriate for assessing a client's personal identity? A. What is your educational background? B. Are your parents still living? C. What do you like about your life right now? D. Where do you see yourself in 10 years? The answer is C. What do you like about your life right now? When assessing a client's personal identity, the nurse should focus on questions that determine how the client feels about himself. This may mean asking questions that help him identify his personal strengths and weaknesses, as well as how he thinks others see him. A drug form in which medication particles are instilled into a liquid and combined through agitation of the solution is called A. Suspension. B. Elixir. C. Syrup. D. Tincture. The answer is A. Suspension. A suspension is a type of medicine that combines medication particles with a liquid solution. When not administered, medication particles within the suspension may settle to the bottom, requiring the nurse to shake the solution to mix. Suspensions are typically given as oral solutions. Following a dose of medication, a client develops inflamed mucous membranes and nasal discharge. What type of minor reaction is this client experiencing? A. Urticaria. B. Pruritus. C. Hives. D. Rhinitis. The answer is D. Rhinitis. Rhinitis may occur as a mild reaction following some types of medication administration. Rhinitis involves itchy or inflamed mucous membranes, particularly around the eyes, nose and mouth. The client may also develop swelling of the nasal passages or clear discharge. Mr. Y is receiving medication through a catheter that has been placed into the subarachnoid space of his spinal column. What route of medication administration is this called? A. Intrapleural. B. Intraosseous. C. Intrathecal. D. Intraperitoneal. The answer is C. Intrathecal. Medications administered through the intrathecal route are given through a catheter that has been placed into the subarachnoid space of the spinal column. These medications are given into cerebrospinal fluid, often for pain control. Placement of an intrathecal catheter is typically done by a trained physician or advanced practice nurse. Which of the following complications is associated with premature rupture of membranes in the pregnant client? A. Vaginal or cervical lacerations. B. Shoulder dystocia. C. Uterine rupture. D. Choriamnionitis. The answer is D. Choriamnionitis. Premature rupture of membranes occurs when the amniotic sac of a pregnant client has ruptured before the onset of labor. The client may be at increased risk of choriamnionitis, which occurs as inflammation of the membranes of the placenta. Infection may develop when bacteria sent into the uterus without the protection of the intact amniotic sac. A nurse is caring for a child whose parents live in a home with several other unrelated children and adults. Some of the people who live in the home have visited, and the nurse discovers that this group all shares finances and living conditions. What type of family is this most likely an example of? A. Blended family. B. Communal family. C. Foster family. D. Extended family. The answer is B. Communal family. A communal family is a group classified as a non-traditional family. In this situation, adults who are not related may live and work with other adults and their children all together in a household. The communal family may share expenses, food, and childcare in the same way as a traditional family. A nurse is educating a female client about progesterone. Which of the following information is appropriate to include in this teaching? A. Progesterone helps the body to maintain pregnancy. B. Progesterone stimulates the breasts to secrete milk. C. Progesterone causes uterine contractions during delivery. D. Progesterone causes development of masculine characteristics in women. The answer is A. Progesterone helps the body to maintain pregnancy. Progesterone is a hormone that is produced by the ovaries in women. Progesterone affects the tissue of the endometrium by developing the lining of the uterus in support of embryo implantation. In pregnant women, progesterone nourishes the uterine lining and limits uterine contractions to prevent miscarriage. Which of the following is considered a Schedule II drug? A. Alprazolam. B. Hydrochlorothiazide, HCTZ. C. Ibuprofen. D. Acetaminophen. E. Oxycodone, acetaminophen. The answer is E. Oxycodone, acetaminophen. Schedule 2 drugs are monitored drugs that have an accepted medical use and are highly addictive, both physically and psychologically. Schedule 2 drugs include oxycodone, acetaminophen, fentanyl, and hydromorphone. The nurse has just administered the first doses of the following medications. Which is most likely the cause of a new onset headache? A. Magnesium hydroxide. B. Sumatriptan. C. Pantoprazole. D. Metoclopramide. E. Sucralfate. The answer is C. Pantoprazole. The development of a headache is most likely a side effect of pantoprazole, a proton pump inhibitor. Sumatriptan is a medication that is commonly used to relieve migraine headaches. Metoclopramide may cause restlessness and anxiety. Sucralfate may cause constipation. Side effects are rarely seen with magnesium hydroxide. They include nausea, constipation, and aluminum deficiency due to overexcretion via binding phosphate in the stomach. A nurse is preparing a client to receive pain medication to aid with the discomfort of labor. The client is being prepped to undergo a pudendal nerve block. The nurse will explain the effects of such a block. A pudendal block is responsible for which of the following pharmacological actions in regards to providing anesthesia during labor? A. A local infiltration of the skin around the vaginal opening to provide superficial anesthesia to the skin. B. A type of anesthesia block to provide total anesthesia to the entire area, injected into fifth lumbar space and may hinder the mother from pushing during the birth process. C. Provides complete anesthesia with injection into the subarachnoid space of the lumbar region of the spine. D. A block specifically formulated to block nerve impulses to the uterus to aid in mother to assist in pushing during the birth process. E. Provides relief of pain from an episiotomy. Blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. The answer is E. Provides relief of pain from an episiotomy. Blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. A pudendal block is a useful type of anesthesia often utilized during the second stage of the labor process. It provides anesthesia for an episiotomy performed in the perineum area. What is the purpose of Beer's criteria? A. To list inappropriate drugs for infants. B. To list inappropriate drugs for the elderly. C. To list inappropriate laboratory tests for infants. D. To list inappropriate laboratory tests for the elderly. The answer is D. To list inappropriate drugs for the elderly. Beer's criteria is used in medicine as a list of drugs that should not be prescribed in the elderly. These drugs can have potentially disastrous complications for older adults, including falls and other serious injuries. Older patients undergoing palliative care typically do not need to follow Beer's criteria. You are the nurse taking care of a patient who is being treated with oral vancomycin, an antibiotic, for Clostridium difficile diarrhea. Which of the following choices best describes the mechanism of action of vancomycin? A. Inhibition of peptide elongation. B. Inhibition of topoisomerase 2. C. Disruption of mycolic acid synthesis. D. Disruption of peptidoglycan cross-linkage. E. Inhibition of integrase. The answer is D. Disruption of peptidoglycan cross-linkage. The correct answer is disruption of peptidoglycan cross-linkage, as this is the mechanism of action of the antibiotic, vancomycin. Vancomycin has high clinical utility in medicine, as it can be administered orally to treat Clostridium difficile diarrhea, or intravenously to treat MRSA infections, among others. As such, it is important to be well aware of vancomycin in clinical practice. Inhibition of topoisomerase 2 is the mechanism of action of fluoroquinolone antibiotics, such as levofloxacin. Disruption of mycolic acid synthesis is the mechanism of action of antifungal medications. Inhibition of integrase is the mechanism of action of some antiretroviral drugs, as would be used in the treatment of diseases like HIV. Inhibition of peptide elongation is the mechanism of action of macrolide antibiotics, such as athromycin. You are the nurse taking care of a patient who is receiving an antibiotic, clindamycin, for the treatment of an oral infection. Which of the following choices best describes the mechanism of action of clindamycin? A. Inhibition of tetraflate reductase. B. Prevention of folic acid synthesis. C. Inhibition of RNA transcription. D. Blockage of peptide elongation by binding 50S ribosome site. E. Inhibition of DNA gyrase. The answer is D. Blockage of peptide elongation by binding 50S ribosome site. This is the mechanism of action of the antibiotic, clindamycin. Inhibition of DNA gyrase is one of the mechanisms of action of fluoroquinolone antibiotics, such as levofloxacin. Inhibition of RNA transcription is one of the mechanisms of action of bacitracin, a topical antibiotic. Inhibition of tetraflate reductase is the mechanism of action of trimethoprim, an antibiotic that is often combined with sulfamethoxazole to inhibit folic acid synthesis. Prevention of folic acid synthesis is the ultimate mechanism of action of trimethoprim and sulfamethoxazole, both individually and when given together. The nurse is preparing to administer 250,000 units of medication to a patient. The ampule sent from the pharmacy contains 500,000 units per milliliters. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 2.5 milliliters. C. 0.5 milliliters. D. 0 milliliters. The answer is C. 0.5 milliliters. Strength of medication equals 500,000 units per milliliters. Required dose equals 250,000 units. Milliliters of medication required equals 250,000, 500,000 milliliters. Equals 0.5 milliliters. The nurse is preparing to administer 100,000 units of medication to a patient. The ampule sent from the pharmacy contains 600,000 units per milliliters. How many milliliters should the nurse administer? A. 2.4 milliliters. B. 0.2 milliliters. C. 2 milliliters. D. 1.5 milliliters. The answer is B. 0.2 milliliters. Strength of medication equals 600,000 units per milliliters. Required dose equals 100,000 units. Milliliters of medication required equals 100,000 over 600,000 milliliters. Equals 0.16 milliliters. 0.2 milliliters. The nurse is preparing to administer a bag of heparin sodium solution with a mix of 120,000 units per 400 milliliters intravenously. At what rate should the nurse set the infusion pump if intending to deliver 1800 units per hour? A. 6.0 milliliters per hour. B. 7.8 milliliters per hour. C. 2.2 milliliters per hour. D. 1.3 milliliters per hour. The answer is A. 6.0 milliliters per hour. According to the question, 120,000 units is mixed in 400 milliliters. So 1 unit is in 400 over 120,000 milliliters. Hence 1800 units is in 400 over 120,000, multiplied by 1,800 milliliters. equals 0.6 milliliters. Hayden is a 9-year-old boy who has been admitted to the emergency room with a fever. He weighs 71 pounds. If the dosing guideline for acetaminophen is 10 mg per kg at 4-hour intervals, how many milligrams of acetaminophen should the nurse administer? A. 293 mg. B. 458 mg. C. 323 mg. D. 710 mg. E. 620 mg. The answer is C. 323 mg. 2.2 pounds equals 1 kg. So, 71 pounds equals 71 over 2.2 kg equals 32.3 kg. Prescription dose of acetaminophen equals 10 mg per kg. Dose required equals weight multiplied by prescription dose equals 32.3 multiplied by 10 equals 323 mg. An infant on his 14th day of life enters the emergency room. He are tachycardic, has poor skin turgor, and is crying without the formation of tears. The nurse knows that this child is showing symptoms of dehydration. The doctor orders fluid replacement of 544 milliliters over 5 hours. What is the drip rate of the infusion? A. 110 milliliters per hours. B. 108.8 milliliters per hours. C. 175 milliliters per hours. D. 200 milliliters per hours. E. 54.4 milliliters per hours. The answer is B. 108.8 milliliters per hours. The question says, over 5 hours to give 544 milliliters. So, in 1 hour give, 544 divided by 5, ml equals 108.8 milliliters. An 11-month-old child weighing 8.6 kilograms enters the emergency room with symptoms of a severe respiratory infection. Her physician suspects bacterial origin and prescribes ampicillin. The guidelines state that ampicillin is to be administered as 50 mg per kg per day in a dose 6 hourly. Ampicillin comes in 250 mg IV solutions of 50 milliliters. How many milliliters should the nurse administer for each dose? A. 25.5 milliliters. B. 250 milliliters. C. 107.5 milliliters. D. 50 milliliters. E. 21.5 milliliters. The answer is E. 21.5 milliliters. Weight of the baby equals 8.6 kg. Prescribed dose of ampicillin equals 50 mg per kg per day. Daily dose of ampicillin required for the baby equals 50 times 8.6 mg equals 430 mg. Dose of ampicillin to be given every 6th hourly equals 430 divided by 4 equals 107.5 mg. According to the question, available strength of ampicillin equals 250 mg in 50 milliliters. That is, 250 mg is there in 50 milliliters. 1 milligram is there in 50 over 250 milliliters. So, 107.5 milligrams is there in 50 over 250, multiplied by 107.5 milliliters equals 21.5 milliliters. Evelyn is a 3-year-old girl who has been bitten by her family's dog. She has had an incision and drainage, I&D, of her left hand to prevent infection, and she has been prescribed cefazolin. The guidelines for cefazolin are 25 mg per kg per day. Evelyn weighs 42 pounds. How many milligrams of cefazolin should the nurse administer daily? A. 524 milligrams. B. 367 milligrams. C. 819 milligrams. D. 475 milligrams. E. 1025 milligrams. The answer is D. 475 milligrams. 1 kilogram equals 2.2 pounds weight of Evelyn equals 42 pounds equals 42 divided by 2.2 kg equals 19 kg. Prescribed dose of cefazolin equals 25 milligrams per kg per day. Required dose for Evelyn equals 19.1 times 25 equals 475 milligrams per day. The nurse must administer 1 liter of sodium chloride solution over 8 hours. What is the appropriate rate in milliliters per hour that the nurse must set on the IV pump? A. 125 milliliters per hours. B. 150 milliliters per hours. C. 100 milliliters per hours. D. 200 milliliters per hours. The answer is A. 125 milliliters per hour. Required dose equals 1 liter in 8 hours equals 1000 milliliters in 8 hours. So, per hour dose equals 1000 divided by 8 equals 125 milliliters. The nurse prepares to administer naproxen to his patient. The physician has ordered 1500 milligrams per day in divided doses. The medication label reads 1 tab equals 0.3 grams. How many tablets equal the daily dose of this prescription? A. 5.5 tab. B. 4 tab. C. 5 tab. D. 3.5 tab. E. 4.5 tab. The answer is C. 5 tab. Strength of 1 tab equals 0.3 grams equals 300 milligrams. Prescribed daily dose equals 1500 milligrams. Tablets required equals 1500 over 300 equals 5.